We're very pleased to offer the topic of exercise today, and we're calling it Maintaining Mobility, the importance of exercise in making sure that we stay safe and that we stay mobile and preventing decreasing our risk for falls. And we're glad that we have with us today Stephanie Groth, PT, DPT. Stephanie works for UChicago Medicine. She obtained her Doctor of Physical Therapy at St. Louis University, graduating in 2018. After completing an orthopedic residency training at the University of Chicago Medicine, she became a board-certified specialist. Since her residency, Stephanie has worked at the main campus of UChicago Medicine, as well as the South Shore Senior Center, providing outpatient physical therapy for adults and seniors with a wide variety of conditions. And she will be talking about our topic today. And also joining us is Wesley Polfus, who is one of our exercise leaders. And he'll be sharing a little bit at some point in the program about what his philosophy of exercise and what he does in his exercise programs. And Stephanie is open to taking questions throughout the presentation. And also you can always put them into the chat, and I will be looking at the chat to see if there are questions coming up. So with that, I want to welcome Stephanie, welcome Wesley, and Stephanie, I'm going to turn it over to you to start sharing your screen.
Hi, everyone. Thank you for having me today. Okay. So can everyone see the slide mobility?
Yep.
Okay, great. So these slides I'll be going through today were created by the Share Network. So they're not my content, but they have really, really wonderful content like within them. And I think they really represent a lot of the main points that we want to talk about in relation to maintaining our mobility as we age. So like Barbara was saying, please feel free to unmute yourself and bring up any questions or thoughts or reflections that you have about your own experience or loved ones' experiences as we're going through the presentation today. So as you know, the Share Network is bringing older adults, caregivers, primary care providers, and geriatric specialists together to share our knowledge and resources. We're building this presentation off of one of the M's, mobility, of the age-friendly health system. So today that will be our focus. We're going to be talking about overall the importance of mobility, how mobility plays into falls and preventing falls, and exercise. So the importance of mobility. Staying active will help you to maintain your independence. Staying active and exercising is well known to reduce levels of stress and anxiety because of the hormones that are released when you exercise. Exercising can help improve your energy and reduce fatigue. This might sound contradictory, like when you exercise, you feel tired afterwards. But what happens is you build strength up so that it's easier to get tasks done. So when you have a larger level of baseline strength, it's not as tiring to do the day-to-day activities. It's well known also in research that exercising regularly improves your balance and decreases your falls. This is related to the strength in our quadriceps and our hip muscles. So two of those major muscle groups are important for maintaining our balance while we're standing on one leg, while we're stepping over objects. It's about our reaction time when we're encountering a balance challenge, an unexpected change in a surface, or being like knocked off balance by someone or some animal. Having a good level of strength and control over those muscles and over your joints mobility helps you to catch your balance from any challenges. Exercising regularly helps you to sleep better, and it helps to maintain a healthy weight. And this healthy weight concept goes in both directions. As we age, a lot of times what we see is there's a decrease in appetite, which can lead to frailty. So frailty is a combination of things that includes losing muscle mass And frailty is linked to a number of other things. So exercise helps to boost your appetite to help counter frailty. And then, of course, exercise, as you build more muscle, helps you to have a healthy level of fat in your body and burn calories. Other kind of more nitty-gritty aspects of exercise is how exercising regularly helps to control your blood pressure. It helps to improve and maintain cognitive function. So there's a lot of research about how people who exercise regularly have better memory and can problem solve faster. Exercise helps perk up your mood. So it's, again, related to those hormones that are released during exercise. It can help with depression and anxiety. And finally, kind of related to the balance thing, where the stronger you are, the faster your gait speed. So gait being how fast you walk. And there's research about normal gait speeds for different ages and how, and they kind of compare your gait speed or how fast you walk to different falls or health conditions. So diving a little bit more into falls. Any questions about those first concepts, by the way? Okay. Diving a little bit more into falls. I'm sure most everyone in this group knows somebody who's had a fall, or they themselves have had a fall, or a near miss, as we call them a lot in physical therapy. So this is kind of a nice visual produced by STEADY, which is an organization and research done by a group from the CDC. So you can see on the left side of the screen, in 2018, we had 52 million older adults in the US. And in that year, 36 million falls occurred. So most people, like if you spread them out over the number of people we had, most people had a fall, or a good chunk of people had multiple falls. And they expect that to continue to increase as the years go on. So addressing falls and preventing them from happening is a really important thing. Again, just another stat, 3 to 4 out of every 10 people over the age of 65 fall each year. Up to 75% of people who fracture a hip never recover to the point where they were before they had their fracture. So with falls, hip fractures are a really common thing to have happen. And of course, when your body has an injury, sometimes it's tough to recover. And as we age, that gets even more challenging. So really finding a way to prevent or reduce falls is a really, really important thing to maintaining our overall level of mobility and health. So some things that are associated with more falls include weakness of your legs, include vitamin D deficiency, and any walking or balance problems, having a lot of medications that you have to take, having vision problems, and having foot pain or foot wear kind of problems, I guess you could say. So the weakness goes back to our ability to navigate different challenges in our environment and recover from balance challenges. Medications, different medications can give you different side effects. So that's why it's really important to be talking with your doctor and have a really comprehensive list of what you're taking exactly, because what it's called polypharmacy, when you have too many medications, that can increase your risk of falling. Vision problems, important to keep up with your eye doctor appointments to make sure you have the right glasses. Important to look at your home environment to make sure that that's not making it more difficult for you. So for example, if you know that you have a harder time seeing at nighttime, and you know that you have to get up a couple of times at night to go to the bathroom, set up a few night lights or keep a light on that makes a clear pathway for you to get to the bathroom so that your vision problems don't increase your risk of falling at nighttime since you already have the pathway lit. When it comes to foot pain or foot wear, how we step impacts our center of balance. So having footwear that helps us to step a nice normal heel to toe pattern and not be shuffling on our feet will help us with that. So for example, footwear that wouldn't be ideal would be slide-on slippers. where you don't feel like you have to kind of shuffle to walk with them, or you feel them shifting under your feet, or you feel one of them falling off a little bit when you take a step. Those kinds of footwear are going to put you at increased risk of falling. I know everyone likes to be comfy at home though. So an example of how you could navigate that challenge is buying slippers that have a heel around the back, so you can walk more normally but still be comfy. In terms of home setup kinds of things, you want to look around your home and see what is going to put you at more risk of falls as well. So any steps or flooring issues that need to be addressed, moving throw rugs, and again, the lighting that we talked about, where you need to try to set up some night lights to make a clear pathway for you when it's harder to see in the evening time. So knowing what we talked about before, like falls have a huge impact on your life and on your health. It's really normal to have a fear of falling, especially in the city of Chicago, where we have snow and ice and salt and cracked sidewalks outside. So the problem is, though, once we are more fearful of falling, a lot of times what I see is that people limit themselves, where they avoid staying active, they avoid getting out, and they start walking and moving in a smaller way. The impact of that goes back to what we were talking about before with things that increase your risk of falling. When you move smaller, you don't take as good of steps, and that puts you at risk of losing your balance. When you don't stay active, you lose your strength and you lose your balance. So that also puts you at greater risk. So it's this toxic cycle that's really important to address. So I'm really glad that everyone is here today and is open to talking about exercise, and hopefully open to talking about the realities of this fear of falling as we age, so that we can stay ahead of it. So some things, like just overall things I'm sure you already know, and things that we've already mentioned, is like it's like kind of tying it forward to your healthcare. So just be really honest when you're in the clinic with your doctor about any falls or balance issues that you have. And everybody has a different definition of fall. I've had patients only count falls if they were injured. I've had patients only count falls if they got to the floor, but I count falls, I call them near misses. I take all of those into consideration because they're all going to change how you move. Your health conditions can have an impact on your balance, and the medications. So just having really transparent conversations with your doctor about those. If you fall, let's kind of bring it forward first just to the doctor's visit. Like we said, talk to your doctor about it. Maybe write down the day after or something, what was going on. Were you feeling tired? Were you feeling dizzy? Had you drank any water that day? What are some things kind of around the circumstances of that fall? Was it something related to your home setup that needs to change? Because we want to prevent that from happening again as quickly as possible. And then we can also make a plan from there. So if you fall, you want to talk to your doctor about it. Got to figure out if there's any kind of care that we need to do to help rule out any fractures or any injuries. So just sending your doctor a My Chart message, or going to urgent care or the ED, whatever is most appropriate based on how you're able to move, is going to be good to follow up with. And this is all of the things we might do in the clinic. Yeah. Sorry, was that a question?
Good.
Oh, okay. Keep going. So when it comes to preventing falls, let's say you talk to your doctor about being nervous about falling or having a fall, and you're wanting to get things in check. The first things we want to address are the things within your system. So we want to have your vision checked, make sure you've got the right glasses that you need. Then a lot of times there's going to be a foot check to make sure that you don't have any like numbness or tingling or wounds or whatever that is contributing to how you're walking. Might check out your hearing if that had an impact in the situation where you felt off balance. And then, like we talked about, looking at the home safety kinds of things. So keeping the lighting, getting rid of throw rugs, talking about clutter and spills that can lead to issues. And then getting on to the most fun part is the strength and balance training side of things. So physical therapy is a great resource in terms of assessing your balance and getting a plan started. What physical therapy's goal is to further assess your like body and your health and your strength to see what factors were most likely contributing to your fall from that perspective. And then we build a plan around that. So when it comes to physical therapy, no person is exactly alike. There's going to be individual attributes about your flexibility, about your strength, about your control that are going to help us individualize your plan for therapy. And beyond that, it's about what you are looking for as well. With a pandemic, different people are feeling like more safe to come to a physical therapy appointment or not. Some people prefer to do more stuff at home or not. So we really want it to be an active conversation between myself or your PT and you on what your goals are and what's realistic for you to come out and do. So getting into like the exercises that we might do in physical therapy and what our end goal is. With reducing falls, with maintaining our overall health, the physical activity guidelines for Americans put out by the American Heart Association recommend 150 minutes of moderate intensity aerobic exercise every week. So that adds up to about 30 minutes, 5 days a week. Now that's a goal. A lot of people aren't able to do that. Again, going back to being in the pandemic, being stuck at home, it being the winter time, that's a really big challenge. So I don't want anyone to feel overwhelmed. It's like, well, it's all or nothing. If I'm not getting 30 minutes a day, it's not worth it. That's not true. We want to start where we're at, but this is a goal to work up to for your optimal health as we're aging. So how to kind of get started? It depends on how much you've been exercising, with how quickly or intensely you get into this. You know your body's tolerance to exercise better than anyone. What you want to feel is a little bit of a warm up and a little bit of a cool down. So as we age, our body needs more time to get into the exercise like zone. So you want to do about a 5-minute warm up and a 5-minute cool down. And that can look different depending on the person. That might be sitting in a chair, marching up and down. That might be going for a fast walk around your home, or that might be doing something a little bit more intense. But a warm up and cool down are going to be key to help you feel in control of your breathing, help warm up your muscles, help warm up your joints. Other things to consider is wearing the right clothes and shoes for your activity. Going back to what we were talking about with fall risk, you want to make sure you have good shoes on that aren't sliding around, that fit you well, that you feel like you're in control of your balance with. You want to wear clothes that are flexible and breathable so that you don't feel inhibited. You don't feel like they're holding you back with your movement. And then you want to consider what exercises you're picking out to do based on what you have going on. So safety is always our first priority when we're starting to build an exercise program. And then our second priority is just our goals. We want to make sure that you are accomplishing your goals and getting to the point where you want to be with your fitness. For some people, they just want to go for a walk and have some fun, or to have some dancing, have some fun. Other people want to focus in more on their posture, or they want to be able to get up and down from chairs better, or things like that. So you want to just break down those goals with you and whoever you're exercising with, or with your therapist. When we're thinking about
Stephanie, yeah. We do have one question that somebody put in chat.
Yeah, please do.
My doctor recommended ankle weights, that I walk around with them for short times, but my exercise teacher said that they might screw up my biomechanics. I have spinal stenosis, tend to bend over. Mm-hmm. What do you want to comment on that?
Yeah, that's a great question. So there's a lot of different tools that we can use to kind of like further challenge our strength. And when you think about like what ankle weights or holding on to weights while we walk do, they can be more grounding in some ways, or they can challenge us as we're lifting our legs up. I think kind of like what you were alluding to with your trainer, you want to be mindful of how that changes how you move. So if your goal is to focus on getting more upright, but when you put on your ankle weights, you feel like they're pulling you down, maybe that's not quite the right fit for you. and you want to try something else, I would say there's no perfect one addition to a program that's going to like, solve everything. So I think it's nice to have an open mind and give it a try. And it's okay if it doesn't work, especially if you have somebody with you observing you and knowing what your goals are. I think it's fine to say, my doctor recommended I gave it a try. It just didn't work for me. I'm going to keep going with such and such exercise. Yeah.
Thanks.
Those can be useful tools. Ankle weights can be useful tools when you're thinking about different neurological conditions. So sometimes people who have had strokes or Parkinson's disease, sometimes ankle weights can be useful in improving how you walk and working on that. But that is a little bit more into the like physical therapy realm, less so the like generally, I just want to walk better and increase my strength. So yeah. So moving forward into the different types of exercise, we mentioned how the American Heart Association recommends 30 minutes, 5 days a week of moderate intensity exercise. So moderate intensity means like your heart gets pumping and you feel some fatigue and you feel some shortness of breath, but you can kind of still keep talking through it. That kind of moderate intensity can be related to endurance training or strength training, sometimes even balance training. I think of flexibility and flexibility related exercises as a tool to work on our posture and work on our body mechanics, but not necessarily as a tool to improve a lot of our strength or our walking or ability to get around better. So flexibility is a great thing to incorporate into your program to work on your posture and your ability to get around to some degree, but you want most of your program to be focused on the strength and endurance side of things. When you're working with trainers and physical therapists, a lot of times it's really surprisingly easy to integrate your balance exercises directly into your strength or your endurance exercises. So examples of that is Tai Chi as a form of exercise. Tai Chi is an Eastern form of martial arts, I believe, that is for strengthening and posture and balance. Yoga would be another example. Dancing would be another example. There's a lot of ways you can integrate balance into your strength and endurance training. So in terms of endurance is like an aerobic way of exercising. Aerobic refers to like your breathing and your heart rate. Aerobic exercise is really great for people who have diabetes, who are fighting cancers, who have heart disease, who have autoimmune conditions. Aerobic exercise, if in the right amount, is known to really help with energy and depression and our immune system. It's a really safe way to exercise as long as you are monitoring the intensity. So like we said before, a moderate intensity would be a level where you feel like your heart rate and your breathing are challenged, but you can still kind of talk as you go. You're not so out of breath that you can't get a word out. Examples of ways to work on endurance training would be going for walks, doing yard work or housework, dancing, swimming, biking, tennis, basketball, anything like that. The idea behind endurance training is that it's a heart rate increase over a longer period of time. So like we mentioned before, you want to do a warm up and a cool down to give your body time to adjust. You want to listen to your body, making sure that you're challenging it. You're feeling the work of your muscles where you want to feel it. You're not feeling any increase in your pain or any abnormal symptoms. So when it comes to our goals of exercise with arthritis, for example, we want to feel work in our muscles. We don't want to feel joint pain. And I think you probably all know the difference when you feel it in the joint versus when you feel it in the muscle. Other things we don't want to feel are dizziness or chest pain or heartburn, but shortness of breath, a little bit, yeah. Heart rate increasing a little bit, yeah. Those are all really good things to feel. Another key safety tip when it comes to exercise is our hydration, how much water we drink. As we age, our body becomes less efficient at using water and storing water. And beyond that, it is less it doesn't, our body doesn't tell us as much when we need water. So when we're young, we feel thirsty and we drink water. As we age, our body doesn't tell us that we feel thirsty as much. So as we age, especially with exercise, it's more important than ever to drink water bit by bit, even if you're not thirsty. Dehydration, when you don't get enough water, is one of the highest causes of hospitalization in seniors. So drinking a little water before, during, after exercise is going to be really key. In terms of like location of exercise, you just want to make sure that you're in a safe area. If you have balance challenges, look for an area to exercise where there's not a lot of sidewalk changes or a lot of runners or pet or dogs or kids running around that might bump into you. If you're going to be outdoors, make sure that someone else knows where you're exercising in case you don't feel well. Again, going back to as we age, our body doesn't regulate our temperature as well. So having layers is going to be important for our clothes so that you don't get overheated or too cold. And then thinking about any safety equipment. So let's say you have a balance challenge, but you love walking. Maybe at home, you feel fine walking without a cane, but you really want to walk outside, you're kind of feeling unsure. Grabbing some hiking poles or some walking sticks can be a great way to make sure you still get to do that meaningful activity, but you're being as safe as possible about it. Any questions about these like kind of concepts of safety with exercise? Any concerns that anyone has? So moving on, we talked about endurance training. And
sorry,
then
can I mention my question? I'm sorry.
Yes, please do.
My husband here, he has diabetic neuropathy in his feet, where he has very little feeling, and that affects his balance. He walks with a cane or a walker.
Yeah.
Is there anything he can do to be more safe? Because he does have a history of falling.
Yeah, definitely. So one of the challenges of neuropathy that you mentioned is that you can't feel your feet as well, if at all. So your feet are your first contact with the ground to know where you are balance-wise. And think about how common it is to catch your toe on a rug or to catch your toe when you're going through a change in the incline. That can really throw off your balance. So one of the first most important things for people with diabetes and neuropathy in their feet is to have good shoe wear to protect their feet from injuries. So having supportive sneakers, maybe even that go up the ankle a little bit, almost to like the level of a hiking boot, so that he feels more stable and that protects his feet from injury is going to be key. Then it's from there, it's also just acknowledging that the sensation isn't going to change. So it's always going to be a little bit more challenging for him to have good balance. So he is going to need to rely more on his assistive devices like his cane or his walker, as well as his vision to know what balance challenges are coming up and how to respond to them. So for your husband, it will probably be better for him to have like a heavier assistive device when you're outdoors. So if you use the cane at home, use the walker outside because there's going to be more challenges there, for example, and then looking around more at the safety aspect of things, and then just kind of taking your time with it and making sure that you're aware of that safety. But shoe wear is one of the biggest things, because once you get a wound on your foot from stubbing a toe or scraping a foot, those are a lot harder to heal on the further away they are from your heart when you have diabetes. So having your feet protected from those kinds of little nicks and stuff can be really key.
Thank you.
Thank you.
Oh,
yeah.
I hunch over when I walk, and following up on Ellie's question, are there any exercises besides just reminding myself to straighten up that I can do?
Yeah, that's a great question. So as we age, it's really common for our posture to kind of fall forwards, and different genetics and different conditions make that more or less challenging for different people. So I think one of the key things with that is first just the awareness, like knowing it's something that you need to work on. And then finding the exercises or the reminders that work for you. So if we are thinking about reminders, one thing that I have found helpful for folks is if they use a walker, putting a sticky note on their walker, sit up tall, stand up tall, or don't look at me, look ahead, when it comes to like walkers or canes. I find it is really helpful for care partners to be aware of that goal of that person. So tell your spouse, tell your friends, like, hey, can you please help me remember, like, if you see me bending over, can you please just like tap me on the back or on the shoulder so that I remember, remind me to like get up tall. And then it's thinking about what is contributing to that bending over. So sometimes it's from muscle tightness in the front. So for example, our pec muscles come across our chest. And if we spend a lot of time reading or knitting or at a computer, those pull us forward like this. So question one is, do we need to stretch our chest, or is our hips stuck in a bent position because we sit in a chair all day? So do we need to stretch our hips? And then once we do those stretches, do we have the strength to stay up there? So what you might start your exercise program with is a couple of stretches for this front side of your body that's pulling you forward. And then you go on to your strengthening exercises for the back side of your body. So a trainer could help you with this, or your PT could help you with this, but maybe it's doing a rowing exercise, or maybe it's doing a bridging exercise where you're picking up your butt and straightening out your hips. You want to start with flexibility, follow up with strength, and then follow up with application. So we get stronger with what we practice. So we can't just do 2 strengthening exercises for 5 minutes in the morning and then forget about it for the rest of the day. Like you said, you have to keep practicing getting up tall. So it's about doing other exercises or other activities, or having people remind you when you're up to kind of practice that posture.
Thank you.
There's another comment in the chat again
Yeah.
from Ellie. She said, bending over can be risky. I was bent over, my walker ran into an overhead sign.
Yes. So that's awesome. Yeah, bending over. It's a tough one. So going into the strengthening category, so strength refers to our muscles. So there's a lot of research, like we mentioned before, about how strong your muscles are puts you at a higher or a lower risk of falling in the community. So there's a lot of ways that we assess strength in the clinic. We do tests with getting up and down from chairs, going up and down stairs. We just push on muscles to see how strong they are. So this is a really nice, a really important category to work on with your physical therapist or with your personal trainers, just to keep you as healthy and as active as possible. The good and the bad thing about our muscles is that strength comes and strength goes. So for example, if you have a hospital stay, let's say just a small like UTI, you have to stay in the hospital for a day and a half for antibiotics. For every day that you lay in bed, it takes about 3 days to recover. So when you're thinking about a pandemic where you spend most of your days in a chair or in bed or sitting on the couch, a lot of people have lost a lot of strength over the last couple of years because they don't get up and get in the car and go to a lunch with friends, or they don't get up and get in the car or on the bus to go to an event. So keeping up your strength is a real big challenge during the pandemic and as we age, but it's really, really key. So when we're thinking about our programming and we're thinking about our goals, I think it's really easy to kind of get down on ourselves and feel like, oh, I haven't exercised in so long. I'm not going to get better. It's not going to get better. I should just like stop. But no, like it can get better. Muscles can get stronger. It doesn't matter how old you are. You can always build muscle strength. And it's just about like kind of easing back into it and practicing it and doing it with other people, figuring out what works for you to stay accountable to yourself. For some people, it's about having music on. For some people, it's about doing it with friends. For others, it's just about being told what to do, going in and getting out. So it's kind of takes a lot of reflection, but if you keep up with your strength training, if you do some exercises every week, I think everyone can be really happily surprised with how much better they feel about their movement and their walking. So ways you can build strength: you can lift weights, you can use resistance bands, but like our exercise specialist Wesley was saying, there's a lot of things you can do just with your body weight. You don't need a lot of equipment. You don't need any equipment to build strength. There's huge exercise programs like Tai Chi, like yoga, like Pilates, like dancing that build strength without needing any equipment and without needing anything more than a, I don't know, 3 foot by 3 foot space. So I hope that equipment doesn't feel like a barrier to anyone, because you really don't need much. Some small things about strength training is about your breathing. You want to control your breathing. And this is related to the relationship between our abdominal muscles and our breathing muscles. When we're challenged, a lot of times we're bracing from everything. If our abdominal muscles aren't strong enough, we brace even from our breathing muscles too. And that's not great, because that increases a lot of pressure in our chest. So you want to try to control your breathing and do a level of exercise that feels challenging but manageable for you. We've already talked about balance training and Tai Chi as an example, dancing, yoga, anything like that. When it comes to balance training, you just want to make sure your setup is good, where if you feel challenged, you have a way or another person to support you so you don't have any falls. Flexibility, here's a couple of people doing some stretches. So this goes back to, when you want to do it, you want to do it to work on your posture and get more movement. Stretching can feel really good, but isn't necessarily related to falls. So if you have a limited amount of time, it's better to focus on strengthening rather than stretching. However, stretching has a really, really great role in keeping our posture upright. So in terms of fitness, like we said, it can be a big lifestyle change to work towards a goal of exercising more. So what I find people respond well to, or what helps them, is if they try to integrate or add their exercises into another part of their routine. So for example, what that might look like is if you watch a news program every morning, using each commercial break to do a few exercises, because you're not paying attention to it then, right? And it's already part of your routine. So that can be a really easy way to do it. Or if you always talk to someone on the phone in the afternoon, march in place while you talk to them. Try to get your heart pumping, get your muscles working a little bit. Setting it up as another part of your routine is a really helpful way to build a new habit. When it comes to picking out exercises, you've got a lot of different options. You can start with working with a physical therapist on some goals, and they can work with you on specific exercises, or you can dive into some online free resources that you might find on YouTube or on the AARP website. Those can be nice, but they're not always as targeted or as individualized for you. So if you have specific goals, you're going to benefit more from working with a specific trainer, where they can help you really make sure that you're picking the best exercises for you. When it comes to exercising and being a caregiver, there's a lot of things that you can do together, caregiver and partner, to build your strength together and just have another thing that is like a nice little bonding positive activity. So, these are all things that we've kind of already mentioned about going for walks, doing exercise videos, just dancing, anything to kind of stay moving. Like we said, anyone can exercise. You can always build up strength. You can always build up balance. It can look really different depending on what you're interested in. There's no one perfect kind of exercise for each person. You just got to do what is fun and appealing to you that you're going to follow up on. When it comes to my role as a physical therapist, we always say the best exercise is the exercise that we do. So, I don't want to get in a pool. I don't want to swim. That's cold. That's wet. I'm not interested. So I'll never swim, but dancing, that's fun. So I think it just takes some reflection on what interests you, what sounds fun, what sounds feasible, and following up with it. We've already kind of mentioned these things, you got to just pick the level of activity that's right for you. So as we age, sometimes going around the house dusting is exercise. Using a seated stationary bike, that can feel like exercise. Unloading the dishwasher can feel like exercise. So just meet your body where it's at. If you feel it challenges your breathing and it challenges your muscles, that's great. So for the group, like just kind of tying this forward to change and to some reflection, whether you're exercising now or not, what are some challenges you have all seen with exercising as we age or with the pandemic?
The obvious one is we're told to shelter in place, and that means that we don't do as much walking as before. For example, I used to go to the grocery store frequently for my groceries, but now I'm getting a lot of them ordered online.
Mm-hmm. Definitely. And it's safer to do that in so many ways. So it feels like conflicting messages. Like they tell me I should stay safe at home, but then they tell me I need to get out and exercise. Like, well, which is it, So one thing that I've done with a lot of my patients, because sometimes it's hard to walk in your home. Like there's lots of corners to navigate or furniture or rugs. I just have people march in place. And it's surprising. Like if you really are picking up your knees and you're doing it to a rhythm, like turn on a song that you like, you march in place, you're surprised. Just 2 minutes can feel like a really long time, but you can get some great steps in that way. And it be really accessible, and you don't have to worry then about COVID or crowds or snow or ice or anything like that. So that could be something to consider trying.
Yes, I think you're right. You said do what's fun, something you enjoy. And when I exercise to music, I enjoy it much more.
Yeah, definitely. And especially if you liked walking before at the grocery store, finding a way to recreate that at home can be really nice, really, really nice.
Somebody else pointed out bad weather.
Yeah, definitely. Yeah, because then you don't feel as safe leaving your house, or sometimes even just the bad weather can bring your mood down and kind of take away your motivation to some degree. So I think like solution to that for me is always music. And then finding something to do at home to stay moving.
Pain can be a barrier to exercise. If you have problems in your joints or in your spinal column. I walked a lot when I was younger, but now I walk and I have a lot of pain.
Yes, that is a huge barrier. And that can take away so much motivation and so much drive. So pain is a really great reason to see a physical therapist to check in on what you can do. Because even if we can't make the pain go away, there's a lot of things that we can do to make things easier or modify the position to reduce the pain. So for example, if we're thinking about how our hip muscles have a really key role in our balance and our walking, we can strengthen those hip muscles with bed exercise. A lot of times backs hurt more when we're standing. It feels better to bend over. Backs feel better when we lay down. That's totally fine and normal. We can exercise laying down. And then sometimes as we build up our strength from that position, it's less painful to do when we're standing. So yeah, pain is a huge barrier because we don't want to hurt when we're exercising, So yeah, I would encourage anyone who feels like pain is one of their bigger limiters to try to get a little check-in appointment with a physical therapist. Not that you have to go every week for 10 weeks, but just to get a few ideas of how you can navigate that pain.
It seems like with the pandemic and staying at home, we've gone out a little bit more, but it's like endurance and tolerance seems to have lessened.
Yes.
Like, oh, I'm grocery shopping. That's all I'm doing today.
Yeah, definitely. So I think one thing that I also find really helpful when it comes to that is like, it was kind of like what we talked about, like meet your body where it's at. So what I have for some patients that I give them is their like physical activity log, right? So you mentioned like, going to the grocery store can feel really tiring now where it didn't before. You can put that in your physical activity log, like 15 minutes of walking at the grocery store, and count that towards your activity. And then that can kind of help, like you can kind of see like your progress then of like, okay, 15 minutes of walking at the grocery store, I felt kind of tired after, or really tired after. And then you do 10 minutes of exercise later on that day. Then the next week, you kind of keep going with it. And then you will probably find as you keep conditioning your body to get stronger, that those 15 minutes in the grocery store aren't as tiring.
So there's a couple of other comments in the chat box. One is, I'm going to do this one first because it relates to what we were just talking about. Kathy Williams says, I used to enjoy going shopping, but now stores are closed or inventory is down. So I sit at home on the computer and order.
Yeah, definitely. Shopping is like so fun because you get all that visual stimulus and you get to touch the things, see the things. Yeah.
But stores are changing. This is a question. Somebody asked, what is your opinion of an exercise machine called the QB2, if you're familiar with that?
Oh, yes. Yeah, I recommend the QB to a lot of my patients that are seniors because it's a really easy tool to have at home to work on building up your strength. It doesn't take up a lot of space. Like it's probably like 2 feet by 1 foot or something.
So do you want to explain what it is?
Yeah. The QB bike, I could even maybe pull up a picture if I can.
Sure.
Can you still see my screen here? Great.
Yeah, we're still seeing your screen.
Huh?
I got one of
This
those.
isn't it.
No, you don't.
Yeah, this is an example of the
Very much
QB
like
bike.
that.
Oh, here.
So what I like about it is that it's kind of a stepper bike. So there's a stepper like this, and then there's a reciprocal bike, right? This. So when we have arthritis, sometimes our knees or our hips can't get all the way around. So the QB is a really nice tool for people with arthritis. And then furthermore, in the pandemic, when you don't have like a lot of ability to get out for steps, this is a nice way just to kind of stay active. And it doesn't take up a lot of space. So it doesn't become another trip hazard or another item to hang clothing on or anything like that. So yeah, I really like the QB bike for a lot of folks.
I noticed that there are several different models on their website. Do you recommend any particular models?
I looked at the models a little bit. It doesn't look like there's too many major differences. From my perception, like they're all built the same. There's just different levels of tracking. So some you can connect to your Apple Watch or something and track your steps, and some you can adjust the resistance in different ways. So there's a pretty big price difference between the different ones. So, you can kind of like browse at those key differences, but in terms of like the actual setup of it, I think they're all pretty much the same. It's just more or less technology.
I have spinal stenosis and severe osteoporosis. Could they be contributing to my hunching over?
Yes, definitely. With osteoporosis, that is one of those conditions where it kind of the shape of your bones changes. So strength training is like a low-level strength training is known to be really safe and helpful. You don't want to do like impact training or a lot of bending or twisting that could compromise your back. But strength training, using something like the QB bike, balance training, those are all really helpful. So really, like, kind of, I hope the biggest takeaway message is that exercise is safe and important for everyone. What's most important is working with your trainer, with your PT, with your medical team on things that make you individual and what your goals are and what your concerns are. If you work with the right people, it's all going to be safe and helpful.
Lucas, do you want to share your comment?
My comment was a little tongue in cheek, though. But no, just in terms of incentivizing, I think, we all know we should do exercise, but getting what motivates you. That's the tough thing. To motivate my 8-year-old son, you know, he always wants to be on the iPad and say, well, as long as you're on the treadmill, you can be on your iPad at unlimited time. So as soon as he steps off that treadmill, then it's shut off the iPad. But so that doesn't motivate me though. I got to figure myself out though. But yeah.
Yeah.
So,
and sometimes there's other yeah, go ahead. Sorry.
Well, I wanted to give Wesley a chance to talk in just a minute. I just want to say again that we are offering 3 different, we have exercise type programs three times during the week through Chicago Hyde Park Village. We have yoga for balance with Janae on Mondays and Thursdays, and Wesley's class is on Friday. And we invited both Janae and Wesley to attend, and Wesley was able to join us today. So Wesley, you want to talk a little bit about what you do? And you'll have to unmute yourself, Wesley.
I said, great presentation, Stephanie. That was some good information, and it kind of ties into everything that I'm about.
Yes.
Yeah, you know, my name is Wesley. People call me Coach Wesley. My company, I started off keeping it simple, and you know, so when she talked about mobility and stuff like this, I'm not a traditional trainer, because some of the things that I emphasize, other trainers may not emphasize. But it all starts with the mindset, like Lucas was just saying, you know, about that motivation. So my program would be starting with the mindset, and you have to have a reason why. The reason why has to be a strong reason why you want to exercise, why you want to do. What's that reason? The second thing that I differ from a lot of people is one-way trainers is one way that I say the best way to get going is stretching, to get that blood flowing through your system. The blood circulates oxygen, nutrients, and it makes you feel good. So keeping it fitness simple by stretching, breathing, having an accountability partner, having the right mindset, knowing why you're doing this, doing simple things like walking. I'm a martial artist, so we deal with adaptation. So if you have to adapt and move around your house, you do what you have to do. Like Stephanie said, marching in place is just as effective as running. It's effective, but eating 3 meals a day. But the main thing is having that reason why and keeping it simple. There's a threshold. If you exercise long enough, you can't, you know, it's like you're a drug addict. You can't, your body wants to do it. And to me, this is, like I said, I differ from other trainers, is that I emphasize that blood flowing through your system to get started. Because I'm almost 60 years old. I walk like a teenager because I'm flexible. I can move. We're not, and it also deals with that pain. I deal with people with pain. There's good pain and there's bad pain. We got to know the difference. Bad pain is sharp and hurts, feel like something's gonna break. But that good pain is what you get from stretching, that burning sensation. It hurts at the moment, but it feels good later because you can do more. The fall, dealing with the fall. One of the things, in my opinion, I'm actually writing a book right now about the fall. One of the things that we got away from, particularly Americans, is the squat. One of the naturalist things we do as babies is squat. But if we're not flexible enough to squat, we're not getting low, and we're afraid of the fall. I connect a lot of the fall to being afraid of the floor because we're not low anymore. So basically, I'm not gonna hold everybody up any longer, but basically it's keeping it simple. Just whatever you do to get it done, get to the point where this is what you do because you got a strong enough reason why, and then mainly is you want your systems to work more efficient. That's the main thing. And of course, most people want to live longer. So I'll just leave it at that. I meet every Friday here. Also, one of the best exercises that I think is important for balancing all the things that Stephanie mentioned is dancing. So tonight at 7 p.m., we have a stepping class. I'm a part of that class. I'm one of the instructors. So of all the exercises, you know, there's no blanket magic pill to anything, but you, like she said, you do what works for you and you keep doing it. But the studies have shown, other than swimming, in terms of being happy and all that, dancing is one of the best things for balance, coordination, and just being happy. So I'll leave it at that.
Great. Just a couple of other comments that someone commented that they've heard that Bill Gates likes to listen to recorded lectures and educational programs while on his treadmill. Someone else commented that what works for me is Zoom, specific times, and people like Wesley's class. Feeling better after motivates me. And once again, Wesley's information is in the chat, so that if you want to copy it, you can do that.
Right, I left my business card and my website, and also another equipment that's really simple in terms of indoors is that bouncer, especially with the handle. That mini trampoline is very effective, and it works on a cellular level. I just wanted to throw it out there. It's very effective, and it works on a cellular level, you know, in terms of getting workout. Okay.
So any other questions? We often go a little bit past 1, but we are past our typical end time. Other questions for Wesley or for Stephanie?
For Stephanie, can you share with us, I understand that with Medicare, you can go in for a PT evaluation for a half an hour or something like that?
That's a good question. I'm not very familiar with the different Medicare benefits when it comes to like wellness related visits. At U Chicago, we still need a referral to see physical therapy. You can't, unfortunately, just walk in like you can in other Illinois clinics with direct access physical therapy. But really, Medicare loves physical therapy. You know, they know that the more active people are, the healthier they are overall, the less complications they are. So if you're interested at all in physical therapy, I'm sure that if you just tell your doctor, like, hey, I hurt here, I feel off balance, they'll write you a script and you can come in. And again, you can really set that plan with your PT of what you want out of it. If someone says, I just want some exercises I can do at home, I don't want to come regularly, I say, okay, I'm going to give you these today. I want to check your form next time, and then we can be done, you know, or if you want to come in every week for 12 weeks, we can make that happen too. So I would just encourage everyone to know that like you are a part of your team with deciding what you need. So if you're at all interested in giving some assessment and some advice for a PT, please ask for a referral and come see us.
Right.
Stephanie, this is Carolyn. I have a question for you. Since sometimes it's difficult to get from places and Zoom has been a lifesaver, can we ever set up some kind of a meeting with somebody like yourself on Zoom, like a telemedical call?
Yeah, there are, we do have the option for telemedicine with physical therapy. When it comes to like the physical therapy assessment, I do usually prefer to see people in person because, you know, there are some limitations to what I can see or assess if I'm kind of stuck in one position. You know, I kind of like to like move around, push on people, challenge them a little bit. So I usually prefer for the first session to be in person, but there are some PTs who are open to doing it like all virtual. So yeah, so it kind of depends on your goals.
So if we started out with maybe meeting somebody like yourself in person, and then after that, do check-ins on a physical, you know, physical basis through Zoom. So that is possible for you guys.
Yeah, that works. Yep, that does.
Okay, great. That's a good information. Thank you.
Yeah, most definitely.
Any other questions or comments? Well, I want to thank both Stephanie and Wesley for being here. I think it's been very helpful to hear about different options and to hear about different reasons why we might want to exercise and how it can benefit us, and to know what our options are out there. So again, thank you so much, Stephanie, Wesley, and for everybody for attending. We are going to keep the program open so that you can chat, and Laura will be our